Welcome to The Gut Show. I'm your host, Erin Judge, registered dietitian and founder of Gut. I'm also your fellow IBS warrior. Our goal on this side of the internet is to empower those with IBS and digestive disorders to understand their gut better, to have a healthier relationship with their bodies, and to make confident choices to improve their digestive health. During this season, you can expect a conversation around a hot topic related to gut health, digestion, and IBS. As a disclaimer, I am a dietitian, but I am not your dietitian. So everything covered in this episode is meant to be educational and is purely information that you can take back to your healthcare team in order to make the best decisions for you. If you're new here and something just doesn't feel right in your gut, if your symptoms have led you to this podcast, I invite you to start by taking the quiz, What's Your Poop Personality? Your personality type will unveil what your symptoms may mean, what may be causing them, and what you can do about them. This is a free quiz and you can take it today at cover..com or find the direct link below in the show notes. While you're going to take the quiz, let's jump into today's episode. We are back. We are back for the Gut Show. If you have not tuned in for previous seasons, please go back and listen to them. You don't have to catch up before this season, but if you are a follower, if you are a Gut Show lover, welcome back. I'm so excited to be bringing you another season, and I'm pumped to start with a topic that we've kind of covered in past seasons, but not as directly as we're going to cover today. And that is, what do you do whenever you get diagnosed with IBS? What does it mean? And what is your roadmap to getting control? Like, what should your doctor have told you as soon as you got your diagnosis? So as we jump in, I'm going to link a few blogs and different resources on what IBS is and some research around that, because I know that understanding the diagnosis itself can be kind of confusing. But very briefly, IBS is a functional disorder of the gut-brain interaction. This means that the function of the gut is altered and the gut-brain connection is part of that. That is what causes hypersensitivity with IBS, where sensations throughout the digestive process can trigger the pain responsive regions of the brain to be activated, where you experience pain. It can also trigger just some different responses by your body than most people would have. So that is one reason that explains that chronic nature of symptoms, and the reason why, like, you may have symptoms, but someone else without IBS may not have symptoms, even if they eat the same things and do the same things. Now, IBS can be caused by so many different things, including foodborne illness or infection. There's also possibly a link to chronic stress, trauma, damage to the gut. There also might be an environmental component. There's likely a genetic component. There's a lot that we don't know and a lot that we are still learning, especially the role of the gut microbiome. But what you want to know, and what I think a lot of marketing out there may kind of lead you to believe, is that IBS is not your fault. You did not cause IBS. You got kind of the unlucky hand of the draw, and now you have IBS. But this does not mean that you have to live in fear of what's going to happen next. It doesn't mean that you have to live with constant symptoms, and it doesn't mean that you caused it and you should beat yourself up. A lot of times, a lot of suggestions out there around like how IBS is BS, it's not real, or IBS is something that, you just need to eat healthier and it'll go away. That is not true. And so if that is what you're coming into this episode with, I give you permission to release all of that. I give you permission to accept the belief that it's not your fault. And where you are today, yes, your actions might have, played a role in where your health is at. We always have responsibility over that, but there's also likely more going on than just the choices that you've made. And so instead of dwelling on the past, it's important that we think about the future and what you're doing next, and think about what can actually help you feel better, which is exactly what we're going to focus on in this episode. So you've been diagnosed with IBS. Your doctor has given you that diagnosis. You feel confident about it. What happens next? The first thing that you want to do is to assemble your team. Often you're going to get your diagnosis from a medical doctor or maybe a nurse practitioner. Ideally, this is done by a gastroenterologist or a GI specialist. Now, different countries and different healthcare systems have different methods of referrals for specialists. And even in the US, where I live, sometimes there is a bit of hesitancy to refer up to a specialist for something that doesn't seem as severe, which I hate to even say, but often IBS kind of gets clumped into that category. And the problem with maybe just a primary care doctor or, a generalist diagnosing you with IBS is that it does take a bit of clinical expertise and thorough assessment to be able to determine if we can be confident that it's IBS based on the criteria that you meet in very basic tests, or if we actually need to assess more with more thorough examination. And that may include other tests like a colonoscopy or an endoscopy or motility testing or stool testing or various things that are out there. A GI specialist is ideally going to ask you the right questions, listen to what you're saying, and be able to see those red flags a lot more clearly than maybe a generalist would. So, with your team, if you didn't start with a gastroenterologist or again, a GI specialist, I would request a referral from the primary care generalist doctor that you're working with. And you can say, hey, I understand the diagnosis. Thank you. I would prefer for a gastroenterologist and a specialist to manage my care moving forward for this disease. That's going to be a really helpful way to push that forward. Now, you may not always get this, but it's definitely worth it to try. Other members of your team may include a registered dietitian. That's what I do. It's what my team does. I'm biased because it is my work. But one thing that I've learned, for IBS, there are medications and treatments out there. There are gut brain therapies out there that we'll talk about. But when it comes to actual symptom management in your day to day life, you are digesting food and you may be reacting to that digestion process. So, food is very much involved in how you feel every single day. And so, a dietitian is going to help a lot with helping you understand how to utilize food and changes around food to feel better. A dietitian is also going to help you with kind of practical strategies around how to make those changes, how to kind of live in the body that you have, and even some different lifestyle behaviors that are going to be really helpful long term, like habits that are going to be supportive. And so a lot of people can see major results just from working with a dietitian. And I would say, again, I'm biased because this is my job and this is the work that I do, but many times this is underutilized and patients are missing out on really great results that they could have with a dietitian present. So, a dietitian is a fantastic part of your care team. If you can find one, connect with one that is specialized in IBS, which is important. Not all dietitians are well trained in IBS. And so, you want to make sure to kind of, ask that question as with anybody on your healthcare team. What's also great about working with a dietitian is that they're often going to spend more time with you. And so, one thing that you want to think about in assembling your team is finding that leader in your care and the one that you're going to spend the most time with, that's going to talk to you the most, ask the most questions, that's going to monitor your progress over time and help continue to assess what's all going on. Because often, IBS is diagnosed, but it may not be the right diagnosis because it is diagnosed based on symptoms. It may also be one of many diagnoses that you have. There may also be other things that are overlapping that look just like IBS, but then end up not being IBS. And so, as you're working through IBS strategies, you want a leader that's going to help you advocate and just kind of help watch some of those things. And a dietitian is often going to spend more time with you and so can easily be that leader. They also tend to be pretty empathetic, which is really nice. And sometimes patients love that because you have a cheerleader on your team, but you also have someone who is listening to you and really cares about your progress and how you're doing. So that's where a dietitian may fit in. Other members of your healthcare team could be a therapist and or a GI psychologist. When it comes to therapy, stress and anxiety, depression, all of these things overlap with IBS. And there's a lot of debate on the chicken or the egg because we know that the gut brain connection is bidirectional, meaning they're both impacting each other. And so stress does tend to be a huge trigger for IBS symptoms. And living with IBS can actually be kind of hard to cope with. Like there are things that you're going to face that are going to be challenging. And having a therapist that can help you with coping skills, that can help you with acceptance of the body that you're in, and the ability to make choices for yourself against those barriers, and even someone to help with managing like anxiety and stress that can be caused by your gut, but then can also cause more symptoms for you. That can be really helpful. When it comes to GI psychology, GI psychologists are especially trained to provide gut brain therapies and even other diagnoses. And so they're going to help a lot with really targeting that gut brain connection. And there are some therapies, treatment plans that are out there that have been shown to be really effective, including gut directed hypnotherapy, gut directed cognitive behavioral therapy. There are apps out there that offer these as well. But if you can get a hold of a GI psychologist and put them on your team, you're going to get more of a personalized approach with these therapies, which means you're likely going to get the best from them possible, which is ideally what we want if you are like really wanting to tackle this aggressively, but also just get your best care possible. Another member of your healthcare team could also be a pelvic floor physical therapist. I am very pro pelvic floor PT. I refer so many of my patients to PT, even if they don't necessarily meet the diagnostic criteria for pelvic floor dysfunction. But this is really helpful because a pelvic floor PT is going to assess all of your pelvic floor muscles, which surround all of your openings, including your anus through the anal sphincter, and then up even through the rectum. And so they're going to help understand if there is weakness, if there is tension, or even poor coordination there between those muscles that could be contributing to the symptoms that you're experiencing. They can also do visceral manipulation, like visceral therapy on the fascia, like the soft tissue of your abdomen and even your back. And sometimes that can be really helpful. And also getting a full just kind of assessment of how your hips are working, how your movement patterns are going, where you're holding tension, your spine, your posture, tension through muscles, and how things are compensating for each other. That can all impact how you feel. And when you're living with visceral hypersensitivity, again, sensations in the abdomen can feel really painful and they can be really confusing because you feel them a lot stronger than other people may. And sometimes they are related to digestion, but sometimes they're just not, and they're related to something else. And there's like again, more of kind of a bidirectional kind of relationship between those tense muscles. And so that can even impact your digestion. And a pelvic floor physical therapist is just especially good at that, at helping you understand it and doing a lot of manual therapy to help you see results. Especially helpful for constipation or people who deal with incontinence or leakage. But honestly, anyone who is dealing with chronic symptoms, and I believe anyone with a body, can benefit from a pelvic floor PT assessment. Okay, so once you have assembled your team, and you know, okay, who you're working with. And again, this team could expand even more based on overlapping concerns, other diagnoses, other symptoms. IBS does not always show up in your body alone. And many people have a complex medical history. And so you may have a larger team that you want to kind of link together in some way, which is where that leader of your team may come in. But after you do this, then you want to establish your baseline to really learn your body. This is something that I think a lot of people skip once they get their diagnosis because they think that, well, I live in my body every day. I know the symptoms I'm experiencing, so I already know where I am. And like, duh, that's how I got my diagnosis to begin with, right? The truth is, many people don't actually know like the symptom patterns that they are experiencing. They don't know the details of their symptoms, and they don't know even like severity wise, like where they're at. Many times they know the worst parts of their symptoms. They know what seems to be most persistent, and typically what they're communicating is going to be what is most disruptive to their life, but it may not be the full picture. And you are the only one who understands your body. That is 100% true. I believe that as a practitioner. But also, to understand your body, you have to look at the data and listen to what your body is saying. And so often we only listen to the loudest voice of our body, but we don't really take the time to take a step back, take inventory, write down our history, log for a little bit, kind of understand the symptoms that we're experiencing, put words to them, and then be able to build from there. This is where you're going to actually find the most results in finding information online, even through my podcast. I share a lot of great info, but if you don't know where you're starting, it can be really hard to understand what to try, what not to try, and just how to personalize the different tips that you're getting for your own body. It can also be hard to communicate to that healthcare team that you have what progress you're seeing or are not seeing, and help communicate symptoms that would be considered red flags that can help you with getting the right diagnosis or understanding what other referrals that you may need. So it is really important to understand that baseline and really learn your body in your baseline. So one thing that you can do is go through a thorough assessment with someone that can help you put those pieces together. This is like if you say the DIY, right? Do it yourself or done for you. This is done for you. So again, I'm biased. This is where a dietitian that is specialized in this area tends to thrive. We do this for our clients where we do go through a very thorough assessment of all of their history, exact details around their pooping patterns, talking about the symptoms, understanding, okay, where are they located? What does that feel like? If you're bloated, is it fullness? Is it distension? Like, what do you notice? What are you actually eating? When are you eating? How are symptoms correlated with menstrual cycles? How are symptoms correlated with your sleep schedules? What's going on with your stress levels? What does self-care actually look like? How do you spend your time? All of that can be really important. And so having someone do that assessment for you can be really supportive and helpful if you have that resource available to you. If not, you can do this yourself, and you would start with building a timeline of these events in your life. So a timeline of events looks like, okay, go back to where you first remember symptoms beginning or anything kind of changing in your history. And sometimes people will say, I've had symptoms since I was a kid. Great. As much as you can remember, maybe even talk with your family members or people that have been around you and try to map out, like, what did that really look like over time? And where are the moments of significant flares or significant maybe changes in your symptoms, or like significant appointments or tests that you've had, or where your diagnosis fit in? Like, where did that even happen? That timeline of events is going to be really helpful in your healthcare team even understanding how things may fit together. You also, just by going through that timeline of events, may have some aha moments. Some of those will be, oh yeah, I left college and started a new job, moved to a new city. There was a large amount of stress involved. Okay, hint, stress may be a factor that you want to focus on. For some people, it's okay, I had a baby and there was a lot of tearing and my recovery was really difficult. Oh, okay, maybe pelvic floor is actually where you want to go. I was traveling abroad and I got really sick, and I had, food poisoning for a few days. I came back and things just never were normal, or I got COVID and things were never normal after that. Oh, maybe this is a post-infectious case, right? Those are going to give you some hints as to what may be going on. And those that, I know people love the words root cause. We don't really use that in our practice, but if you are looking for why did this happen? What's going on? That timeline of events may give you that insight, especially tied to maybe an assessment from someone that can kind of help make sense of it based on what we know about the pathology of the disease. And then in addition to your timeline of events, you want to start logging and really review your log. So I'm going to share more about this in our next episode. So I'm not going to go too deep into it today. Something fun to look forward to. But logging not just your symptoms, but logging what you eat, how you're sleeping, again, menstrual cycles, if those are applicable, changes in your stress levels, your exercise, supplements, medications, and really the specifics around your symptoms. Not just, I felt bad today, I didn't feel bad today, but how many times did you poop? How much volume? What was the texture? How long did it take? Were you bloated? Were you gassy? How did that shift throughout the day? Those are really helpful details to log to understand, okay, what are these patterns at play? And then not only do you want to log, because that can get really monotonous and be just a constant reminder that you're having symptoms, you want to review your log. And I'm going to give you some tips for that in the next episode. So teaser for that. All right. So you've assembled your team. You have began to understand your baseline and learn your body, where you're beginning. The next thing that you want to do is
Are you listening to today's episode with the main thought being, what are the steps that I can take to get rid of my symptoms right now? While I hope that the information that we share in every episode of The Gut Show leaves you feeling more empowered and more confident in your body, it's not always going to solve your problem or give you a clear direction for your specific symptoms and your needs. The Master Method membership is an online program for the person with chronic digestive symptoms and IBS who wants step-by-step guidance to understand their body, address the drivers of IBS, reduce symptoms, and build resilience in your gut long-term. This membership includes a step-by-step course and a dietitian-led community that teaches you how to holistically address each symptom and the IBS drivers, how to reduce symptoms more strategically and with confidence, and guidelines for better gut health long-term so that you're not only thinking about today, but you're also improving your outcomes in the future. It is time to ditch the symptoms and get your life back. The membership is your first step. You can learn more and enroll at ibsmastermethod.com and use the code GUTSHOW, GUTSHOW, GUTSHOW for $25 off your enrollment fee. Now, let's get back to today's episode.
The next thing that you want to do is support the digestive process. So this is so important. And I said, often people skip over understanding their body first. People tend to never even think about supporting digestion. And I talk about it so often on social media. I talk about it a lot on here, probably to the point where many people are like, okay, we get it, chew our food, whatever. But at the same time, when I'm working with clients day in and day out, so many of them are not doing these things. There tends to be this like, oh, yeah, I guess that would make sense, but no one's really doing it or implementing it. And I've learned in practice, and even in my own history with IBS, that the digestive system with IBS, when your digestive system is not functioning properly, there are going to be more sensations present. And because you have visceral hypersensitivity, you are going to feel all of those sensations significantly. And not only that, your body is functioning at a lower capacity to begin with because of the IBS, right? And this can improve, but oftentimes when you get that diagnosis, you're at a place where your digestive system is not functioning well at all. And so if we are expecting, any treatment to work long term, if we're expecting to find some stability in the gut, you likely are going to need more supportive habits in your life for that digestive process to reduce those excess sensations, to kind of work against that barrier, right, that you already have because of your disease. This is going to be so supportive to give you more results in the other strategies that you use. This is also going to help you have some consistency in how you feel. And it's going to help you really find for some of you, like full relief of your symptoms. This can be the game changer, but it's the hard part because supporting the digestive system is something that you have to do every day. You have to be intentional about, and you have to be consistent with over time. And it's not a pill, unfortunately. It's not a quick fix. It's not a cure that you focus on it for a week and then you're better and then you never have to think about it again. IBS is currently a lifelong condition, and these are lifelong habits that need to be present. And they're going to, wax and wane, is that the right phrase? They're going to get, be great, and then they're going to somewhat fall off. Like they're not always going to be in place at all times, but it is helpful to understand what they are, what tools you have available to you, and find a way to build them into your day and into your life in a way that works. And then kind of take inventory of them over time so that okay, are these still working for me or not? So some of the things that you're going to do to support your digestive process at a baseline, sleep. You have to sleep. Sleep is one of the biggest triggers of IBS and symptoms. Sleep is also necessary for every function in your body to go well. You have to sleep. It is non-negotiable. And the research says 7 to 9 hours per night is ideal. This may change through different life stages, but 7 to 9 hours, and having a consistent sleep schedule as much as you possibly can. This is going to be supportive of circadian rhythms, but also all the hormones involved in digestion, your gut microbiome, the nerves, and even just how the muscle itself is coordinating, as well as that gut-brain connection. So sleep, 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 sleep. If you are looking for the one thing to focus on first, it is your sleep, point blank. If you're not sleeping, you're always going to be working against something, and likely still going to have symptoms. So make sure you're sleeping. In addition to that, looking at those routines and circadian rhythms, eat consistent meals. Before you start making a lot of changes to what you eat, I want you to shift how you eat. Eat consistent meals. That might be 5 meals a day, especially if you're on more of the diarrhea side. It may be 3 larger meals a day if you're on the constipation side. This can vary. And again, working with a dietitian is going to give you more personalization here, but make sure that you're eating consistent meals. This is going to be really supportive and helpful. With your meals, make sure you're eating enough. If you are under eating your calories, and that could be due to chronic dieting, it could be due to disordered eating patterns, it could be due to fear of symptoms. If you are under eating, your body does not have the energy it needs to function, including your digestive tract. And newsflash, your body does not prioritize digestion whenever it is trying to conserve energy. Your body prioritizes what keeps you alive, which is your brain, your heart, your lungs. That's it. You are not prioritizing your gut. Your digestive tract is likely going to get shut down before it takes energy away from those other vital organs. So you have to be eating more than that base need. You're going to have to eat enough that your body can function on. And many people fall into a cycle where they start having gut symptoms. They start restricting their intake. They restrict carbs. They restrict overall calories. They have really inconsistent caloric intake. And then their gut just gets worse and worse and worse. And then it gets to the point where it is very backed up, very slow, very hyper reactive. And then it seems like there's no way to even add more food in, and you can feel really stuck. I don't want you to fall into that pattern. And so making sure you're eating consistent meals and eating enough is going to help you prevent that. If you are in that place, that's okay. You got there, you're there. Let's move forward, work with our team. Best thing I can give you. And then with your other routines, add in consistent movement. With movement, I say movement over exercise for a reason. Exercise is so helpful for health. Exercise is in place to build muscle, so strength, endurance, and cardiovascular health. It's also helpful for flexibility and mobility. Your exercise routines and schedules should meet those 3 buckets. That's really important. In addition to intentional exercise, which you might do 30 to 60 minutes, maybe every day, maybe a few times a week, your movement throughout the day not only helps you with your mobility, all those other things that exercise also helps with, it brings blood flow to your gut so that it can function. Movement can also help with the gut brain connection by giving you an increase in endorphins and those feel good hormones, even helping with stress management. Movement can also help release tension in your hips, in your abdomen, in your back. Going for walks, moving around your house, just getting up and moving around as often as you can be such a game changer, especially after meals. And that's going to support digestion overall. The next thing to think about with your digestive process are routines, especially around toileting. Having a solid morning routine to wake your body up, stimulate some movement in your gut, drink your water, relax your body, sit on the toilet. That can be extremely helpful for the digestive process as a whole. Your routines around self care can also be really helpful. Again, we're thinking about regulating the nervous system there. We can't take all stress out of your life, nor is that even helpful, but we do want to learn how to regulate, and you regulate through your routines of self care primarily and relaxation. Those are going to be really important. And just nervous system regulation as a whole. That is something you definitely want to prioritize, something a therapist can help you with for sure. Diaphragmatic breathing, just learning how to relax, which is so much easier said than done, but finding ways to teach your body how to do that, especially when you're not in so much of a stressed period of your life. If you're actually in a pretty calm place or you have space to work on it, building those muscles, flexing the muscles of nervous system regulation are going to be really helpful when you need them the most. So you've assembled your team, you have established that baseline, you've learned your body, you've supported the digestive process. The next thing that you want to do is reduce gut irritants and your initial triggers. Now, this can vary based on symptoms that you have, and this is where guidance really fits in because there's so much that could be out there. It might be coffee and caffeine, it may be sugar alcohols or non caloric sweeteners, maybe it's raw foods. Maybe it's high fat meals, maybe it's alcohol. It can really vary based on what you're experiencing. I would say this is most often a problem for those who are dealing with diarrhea, but we also can see this in constipation with increased bloating, pain, gas, all of those symptoms. So we want to reduce those gut irritants and the more obvious triggers that you may have. And again, guidance is going to help you the most because just looking at your log and looking at your diet, you might see some pretty obvious things, but you may also think you see something. But if you don't really know the mechanism of how it's contributing to symptoms or not, you could be missing it or blaming one thing that isn't actually related and completely missing something else, which is what most people notice with sleep, which is why I say sleep, 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 sleep. And so that's really important. After you do that, modify your fiber intake. Now, I have threw fiber in here because we've been eating food, right? We've been eating consistent meals. We're eating enough. We're supporting our nervous system. We've got some initial kind of irritants down. Probably not feeling great yet, right? We're really laying the foundation. And so part of that foundation, before we start to eliminate foods and do anything else that's more aggressive in terms of treatment, we want to make sure that we're actually supporting the gut environment, right? Because the gut microbiome is involved in gut brain connection, in the leakiness or permeability of your gut, which contributes to symptoms and even your motility. And if we are not supporting motility itself through fiber, but also supporting the gut microbiome, which supports all those other pieces, then we're likely kind of walking like upstream, right? You're working against a barrier that you don't really need to be working against. And you may see some short term results, but you're missing that benefit of long term results. And so, with fiber intake, modifying it, it's going to depend on your symptom patterns. There might be a period where you actually decrease it, you focus on consistency, you change exactly what you eat. For most people, this is going to look like adding in more soluble fiber and reducing some insoluble fibers. What I'll say here, though, is don't get too intense with this. If you get stuck in the weeds of what type of fiber is this? What's the best type of fiber for me versus thinking about the consistency and, balancing out different types of foods, like you might get down a rabbit hole that doesn't actually help you and you're going to be stuck. So, ideally, get some guidance on this that starts with an evaluation of what you're currently eating so you can learn these different foods. But ideally, soluble fibers, lower fermentable fibers so that we're not increasing any other symptoms, and then cooking those fibers down and increasing them very slowly. After you've modified your fiber intake, that is where it is best to start identifying and testing different dietary triggers. Now, this is where a low FODMAP diet can fit in. This is also where more of a modified elimination and reintroduction can fit in. For some people, based on everything that's going on, this may look like an allergen elimination diet. There might be a food chemical component like histamine. Everyone is going to have maybe a different approach here. The low FODMAP diet is the most studied for IBS, and it is very successful in managing symptoms, but it's most successful done in this way where there has been a good foundation laid and you've done some other things first. After you've identified and tested your triggers, then you want to move towards more of a gut health plan versus just symptom management. So you can see where we've kind of woven this in through the steps that I've introduced, where we're supporting the health of the gut, the function of the gut. That is so important. And so even after you get your symptoms down, you want to lean more into that because that's where you're going to see symptom improvement over time. If you don't support the health of your gut, what is likely going to happen is that you did low FODMAP diet, whatever, maybe you started medication, you found some supplements, you've gotten your symptoms down. You may notice that those things stop working and that your symptoms continue to just get worse. Other parts of your health decline. That's because the health of the gut itself was not supported. Managing symptoms does not always mean you're doing what's healthy and supportive for your gut in the long run. Sometimes those short-term things that help with symptoms can actually work against you or just might not be super supportive. And so we have to make sure we're thinking about that forward motion towards gut health. And this is the game changer. This is how you increase tolerance to foods. This is how you find even more confidence. You travel, you have more flexibility, all of those different things. So that's going to look like adequate and diverse fiber intake, especially that diversity piece, like eating a variety of plants, meeting all of your nutrition needs, like fully across the board, which can also look at healthy fats and micronutrients like antioxidants and even your proteins. Taking more of this kind of Mediterranean diet approach with that can be really helpful. And then being really consistent with your supportive routines. So finding those habits that are going to be supportive and sticking with them long term, making sure that they're working for you and making sure that they are prioritized in your life, because that is going to make the biggest difference. So if I wrote a book, this is what I would write, right? What do you do once you're diagnosed with IBS? These are the steps. But what happens if you just skipped right ahead to more of the complex strategies like the low FODMAP diet or medications or something like that? So you're listening to this, watching this, and you're thinking, oh, well, I skipped this step or I didn't do it in that order. Do I need to start over? Like, what do I do? You may be missing some of those key routines to keep the gut stable, and that would have set you up for more success. You don't have to start over, but I would look at what those could be and just start implementing them now. You may not see full or consistent results from the strategy you are using. So, if you've been doing a low FODMAP diet for a long time and you're like, I don't know, I feel stuck, I feel like I can't progress, it actually might be time to like set that aside for a moment and then go back to step one and start building those steps up or build them up quickly in addition to what you're doing so that you can move forward so that you're not staying restricted or stuck too long. Ultimately, if a strategy isn't actually working, give it up and move on. Except those like foundational digestive support strategies, those can take even a couple of months of being super consistent to see significant results. So you want to give that a longer time. And then something else that can happen that I mentioned, right, is that you may not be supporting the health of your gut. You may have less resilience and overall just lacking that gut health. And so if you're thinking, well, I just want to feel better and that's all I care about right now, that's okay. Like stay there for a minute, enjoy the freedom you're finding today. But I encourage you to take some time when you do feel ready and you're open to really think about what you want 5 years, 10 years, 15 years, 20 years from now with your health and with your life. And not just thinking about it in a negative way, but thinking about what's possible for you. And that can be a strong motivator to implement some of these habits that are going to be helpful. And it can be scary because, I'm saying all of this like it's super easy, but adding in some of these things that are going to help with your gut health may trigger symptoms. You may have to challenge your body after you found symptom relief to do things that you're not sure of. And that can be really scary and hard when you feel good, right? It can trigger past experiences and almost like a trauma response for some people. And so, again, getting good guidance on what those steps will look like and how to approach them, and even knowing what to do if symptoms come back or how to handle that, it's going to be really important. And that's going to be something that, getting that personalization from a coach, a dietitian, a provider, whoever it may be for you, it's going to be really valuable in those steps forward. So you have IBS. This is what you do as streamlined as possible. I hope that this has been helpful and just even challenging where you're currently at to think about, okay, what do I do next? Or how do I get unstuck or maybe off the internet and into my real life and figure out like what these next steps are going to look like. Again, we'll have some resources for you in the show notes. So if you need that, they are there. And then we have so much coming your way in this season. Next week, we are going to talk about logging, and I'm very excited for that, tracking, kind of how to go about that. But we've got a lot of fun topics, and we also have so much from our previous seasons that are already available. So if you're waiting for new episodes to come out, go through some of the older episodes, listen to them. There's a lot of interviews and different hot topics and things that can be really helpful and supportive, and they're all titled, so you can just scroll through and find what works best for you. If you find that anything is helpful, it always helps to have a review, a save, a share. This makes such a big difference with our reach in our community, making sure that as many people get these resources as possible, and just helps us continue putting this out. So if this has been helpful, please do that. And if you want to interact with us, you can follow us on social media. You'll see that in the show notes. Send me a message, share in your story what you learned, what you took away. Engage there. I would love to hear from you. We also have a Facebook group that you can join and share if you would like. And we have a membership program that can be really helpful if you're looking for more guidance, but also a lot more interaction with myself and my team.